I have a button, I don't have it on right now, but I really love it. And one of my nurses brought this home to me. It says, "I was calm until you told me to calm down."
Oh, man. Labor.
And how that relates to pain kind of is like, okay, I was handling this okay till you told me I should be handling it okay. You know, I mean, we're all here, you know, we haven't blown our brains out, and suicide's always there lurking in behind you, you know, when you have chronic pain. So it's like, I don't even ask the question, are you suicidal? Because it wouldn't benefit to lock somebody up in Warm Springs with their chronic pain. That's not going to contribute.
And actually, if you are suicidal with chronic pain, you don't get treated, right? That's a reason for rejection.
Yeah. Yeah, you're
Which
even more
sounds kind
dangerous.
of nuts.
Yeah.
You're
Well, the
not
system's
saying
nuts.
almost kill yourself, so I'm not gonna treat you.
Well, or you start taking the antidepressants, which when you read the fine print, they all say you may become suicidal.
Yeah.
And then you sit back and go, well, I've already been looking at bridges to go off of.
Yeah. Yeah. And
And
that is so goofy.
Are antidepressants real? My own, I think they're placebos myself. I really do.
Well, if they haven't worked in you, then you would think that.
Yeah.
Well, and I've taken 50 of them, and
Yes.
and you get the sedative effects, so you're non-functional.
Yeah.
But other than that, for me, they don't. do
But you don't have a serotonin deficit, so of course an antidepressant wouldn't necessarily work on you.
Right, except then the doc is gonna say, well, let's push the dose. And then you're a zombie.
Yeah.
Sometimes, I don't know, with antidepressants though, I mean, when I was taking some antidepressants and stuff, people noticed a change in me, but I didn't. I didn't feel any different. But they said, you were much happier, you're taking things much easier.
Yeah, but
And
see,
I thought, I
they're
didn't
getting the
notice it.
placebo effect.
Yeah, they're getting it.
No, they know you're taking it. They expect you to be
No, they
happier,
didn't know I
so
was
they
taking it
see you
because
happy.
No,
I
they
didn't tell
see the
anybody.
change.
Or the other
say
thing is
anybody.
that you're modulated. Like you're less up and less down. So people don't care about how happy you are. They care about how annoying you are.
Yeah.
And if you're less annoying, it works for them. It's like, okay, take that medicine some more. You know?
Which can also take the edge off, and you're not bothered by things that otherwise
Yeah.
really bothered you because you were already bothered. And when somebody does something really stupid, you know,
Well,
you're
I wouldn't
not
do that.
sitting there going, that was really stupid.
Yeah,
You
you're
know,
like,
because the edge has been taken off.
more
and so now
stupidity,
you're
it's the
just
same.
Keeping it to yourself.
Yeah, yeah.
I think antidepressants actually contributed or maybe was a cause of my oral pain. They got so desperate they started using. And I probably wasn't even depressed. I mean, they make their observation on, well, your hair wasn't combed or something like that. Or your house was messy, who knows? At any rate, the antidepressants, they started going old school on me. My mouth was so dry. I got yeast infection, oral thrush. I got some other weird little thing growing in my mouth.
Like plaques or something? Yeah.
Lichen planus.
Mhm.
I think maybe I think that kind of started it, the mouth problems.
Yeah.
You wear a dry mouth, by the way.
Yeah.
Yeah.
I'm dry mouth all the time.
Creates environment for oral thrush, so.
Yeah.
So have you ever taken
decay.
this stuff that
That
is supposed to fight
spray?
that? I mean, there's
Fight
there's
dry
words
mouth?
told. Well,
There's
I
a
haven't
pill
tried it,
now,
but-
there's a pill now called Evozac.
Yeah.
Really, it's because it's new, it's got a really high copay. Well, like all drugs, it kind of works. I take it at night. During the day, I can use, water,
Yeah.
mouthwash, whatever, but it's the nighttime that's a
I always have to have water next to the bed so I can drink all
problem. See,
night.
then you're still waking up, and then
Yeah.
you're in
You
pain,
never
and
sleep,
it's hard to
yeah.
get back to sleep.
I don't know the last time I ever had a night's sleep.
Gotta get an IV in, huh? Water.
Yeah, no doubt.
It doesn't help.
Have to
It's
And
not about hydration, it really is about mucosal health.
Production, yeah.
Yeah. Now, there's people who've had, yeah, I know Lance, a Iditarod musher who had, you know, an oral cancer and radiation and lost all his salivary glands. And it's a life-threatening thing for him to keep his liquid water liquid while he's
All out.
dog mushing.
Yeah.
And it's, you know, unless he has liquids, you know, he has a little pocket right by his chest, and it's buried in here, and it's a neoprene thing, and he keeps at least one bottle right there, so that he can, you know, he's gonna suck on it frequently, but it's gotta be liquid. And, you know, he's figured out a way, hand warmers and all kinds of things.
I've been carrying around crushed ice for 5 years.
Yeah,
This accompanies me almost everywhere.
yeah,
I'm a little sick of it, but
yeah. Not as sick as you are of the dry mouth and the discomfort.
it actually, yeah, it lessens the pain a little bit, quite a bit, but it's hard to keep ice in your mouth all the time.
Yeah,
That's
Well,
when you're
no.
trying to sleep.
And as soon as it's gone, you're dry again.
Yeah.
It's just like drinking water. They're really good for that first 2 or 3 seconds and dry.
Well, that's why I do the crushed ice, you get a little bit longer effect.
Yeah. Yeah, I've tried sucking on ice cubes and stuff, but and that spray stuff works great for about 30 or 40 seconds and then right
If
back
you-
to it.
If you crush the ice, it works a lot better than big ice cubes.
yeah. And no chipped teeth.
No, I crush it and I
Yeah.
don't abuse my teeth. They're already in enough trouble.
Yeah, and so this whole mystery about your mouth aching, I mean, that's just like that puts you in the 1 in a million.
Yeah,
Category.
which kind of makes me not very hopeful, you know, and totally giving up on Montana medical care.
Sure.
I mean, it's like I'm doing Stanford, Johns Hopkins, you know, Cleveland, whatever, because I know it's long shots even there.
Yeah.
And it's expensive. So the chances of finding someone in Helena to help